DEA registration for behavioral health prescribers is non-negotiable. Without a DEA number, a prescriber can't write for controlled substances at all. A psychiatrist without a DEA registration could not prescribe common psychiatric medications. The number is what authorizes a prescriber to write for controlled substances. DEA Registration Basics for behavioral health prescribers: who needs it, how it ties to credentialing, and how to keep it from lapsing. We cover which prescribers need a DEA number, how payers ask for it during credentialing, the rules for multiple states, and how to keep it current. If you are a prescriber, an MD, DO, NP, or PA, you need a DEA number to prescribe controlled substances. The DEA registration applies to prescribing roles. Psychologists generally don't prescribe, so it centers on your medical and advanced practice prescribers. It's not strictly a credentialing requirement, but not having it limits practice, and payers ask for it on applications for prescribing roles. If your license or DEA registration lapses, insurers can temporarily suspend you from the network and deny claims until it's resolved. Maintaining active credentials means renewing your license, malpractice, and DEA on time, or a gap can drop a prescriber from the network. A DEA license about to expire is a common pitfall. It can pend a credentialing packet till you renew and resubmit. Behave Health stores provider data, license numbers, NPI, CAQHID, and DEA expiration dates, and is designed to alert your admin before a credential expires. Provider profiles are designed to centralize credentialing data, including DEA expiration dates, as a single source of truth. The platform is designed to flag an upcoming expiration, for example 60 days prior, so renewal paperwork is ready in time. 4 basics decide whether your prescribers stay authorized and whether your credentialing files hold up. Let's walk through all 4. Miss any one of these, and a prescriber can be limited, pended, or dropped from a network. Here are the 4 basics. Basic 1. Make sure every prescriber who writes for controlled substances holds a DEA number. The DEA registration is tied to the individual prescriber, MD, DO, NP, or PA, who writes for controlled substances. Without it, a prescriber can't write common psychiatric or controlled medications, limiting the care your program delivers. Basic 2. The DEA registration must be for the state where the prescriber practices. Your DEA registration must match the state in which you practice. Practicing across state lines means you may need more than one. If a prescriber practices in multiple states, plan to obtain additional DEA registrations, one for each state where they write prescriptions. Basic 3. Give the DEA number to payers. They ask for it on credentialing applications for prescribing roles. Insurers typically request your DEA number on credentialing applications when you're in a prescribing role. Have it ready alongside your license and NPI. When you build your CAQH ProView profile, upload supporting documents, license, DEA, and malpractice face sheet so payers can pull them. Basic 4. Obtain and renew the DEA registration as needed, and never let it lapse. Renew your license, malpractice, and DEA on time, and send updated info to networks. A lapse causes denials until resolved. Keep an updated digital folder with your license, DEA, and certifications. When something renews, replace the old version. If your program dispenses methadone as an opioid treatment program, the rules go beyond an individual prescriber's DEA number. Opioid treatment programs that dispense methadone must be certified by SAMHSA, a federal approval on top of state requirements. An OTP must also be registered with the DEA, not just rely on individual prescriber registrations. OTPs must have physicians with a special registration, and payers may require proof of your SAMHSA certification. One basic has shifted recently. As of 2023, the special DEA X-waiver for buprenorphine was eliminated. The separate buprenorphine waiver no longer exists, simplifying the path for prescribers treating opioid use disorder. Now, any DEA-registered physician can prescribe buprenorphine for OUD, within limits. The base DEA registration is what matters. Behave Health is designed to centralize provider credentials so DEA expirations don't slip through and trigger denials. Provider profiles are designed to hold license numbers, NPI, CAQHID, and license and DEA expiration dates as a shared source of truth for your team. Expiration alerts are designed to notify your admin ahead of a renewal date, so paperwork is ready before anything lapses. Keeping DEA and license data current is designed to help prevent the gaps that drop prescribers from networks. Stop letting an expired DEA registration suspend your prescribers. Book a 20-minute demo at behavehealth.com. See provider profiles and expiration alerts built for behavioral health credentialing at behavehealth.com.